Hello, in this video I'm going to be talking about tamoxifen at a lower dose, specifically 5 milligrams of tamoxifen. Who's it for, what are the benefits, and how do you talk to your doctor about this possibility for you? Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch, and you never know, the video that pops up this week might be just the one you need to hear. I also want to invite you to go to Yerbba.com to get your personalized breast cancer report. So tamoxifen 5 milligrams, lots of people have been asking about this in the comments, and indeed there's some data that 5 milligrams of tamoxifen may be better tolerated and be equally effective as 20 milligrams, the standard dose of tamoxifen, in some people. So which people might this be right for? Let me just start with a headline, not for people with invasive breast cancer. Invasive breast cancer, the data that we have indicate that 20 milligrams a day for 5 to 7 to 10 years, depending on your other treatment options, is the right dose. We used to use 40 milligrams, and 40 milligrams was no better than 20 milligrams in invasive breast cancer and had a lot more side effects. So going from 40 to 20 milligrams actually was a big advance in making sure that treatment is more tolerated for people with breast cancer. So who is then a candidate for 5 milligrams of tamoxifen in the treatment of breast cancer? Okay, so I'm just going to be really brief here. People who have either a precursor to breast cancer, meaning a higher risk of getting breast cancer, or non-invasive breast cancer. So let's get more specific. People with atypical ductal hyperplasia and people with lobular carcinoma in situ, not cancer, not even non-invasive cancer, are both at higher risk of getting cancer, not just in the affected breast that has the atypical ductal hyperplasia, or the LCIS, lobular carcinoma in situ. They have a risk in that breast, but also in the other breasts. These folks have been shown to have tremendous benefit from tamoxifen or raloxifene. We have another video about raloxifene, we'll pop in here. Those folks benefit from tamoxifen, but taking 20 milligrams a day, the same dose that people with invasive breast cancer, may lead to side effects without the same degree of benefit, no real survival benefit, just cuts the risk of getting breast cancer. So the study called TAM-01 randomized people to 5 versus 20 milligrams, and there were two main findings. The first is 5 milligrams was just as effective as 20, and side effects were much less frequent and more tolerable. There's one other group of people who can take 5 milligrams of tamoxifen, at least based on this one study, and that's people with ductal carcinoma in situ, also called DCIS, stage 0, or non-invasive breast cancer. So people with DCIS don't get a survival benefit from tamoxifen. The benefit is in decreasing the risk of getting cancer in the same breast or the other breast, and 5 milligrams seems to be as effective as 20 milligrams and is better tolerated. Listen, the best endocrine therapy if you have atypical ductal hyperplasia or lobular carcinoma in situ or DCIS is the endocrine therapy you can take. You have lower risk disease, you can have lower side effects. If you want to learn more about your options, you can go to Yerbba.com and get your Yerbba report. Your Yerbba report will show you all the things we know about your cancer and all the treatment options you might hear about when you go to your doctor, and perhaps even some that you may not hear about, cross-referenced with the latest medical information and everything, again, that we know about your cancer. It tells you the pros and cons of treatment, and my favorite feature, it gives you questions to ask that you can put in your notes to take with you when you go to your medical team. I hope this has been helpful. Drop a comment or a question below. We'll see you next time, and as always, thank you for watching.